A 37-year-old man comes to the emergency department due to fever, chills, and malaise, or feeling sick, feeling malaise. No sign medical history. Illicit intravenous drugs. Okay. Patient is febrile, bukhar hai, tachycardia. Okay. Hypotensive. Low BP. Auscultation is a heart murmur. Okay. A predetermined diagnosis of infective endocarditis. Okay. Blood cultures show MRSA. Okay. What is the drug of choice for MRSA? Yes, it's vancomycin. Very good. If you said, I'm proud of you. And if no, then you have additional knowledge. For MRSA, drug of choice is vancomycin, and if there is vancomycin resistant staph or resistant streptococci, then the line is valid. Always remember this. Fine. Patient is prescribed intravenous antibiotic administered every 12 hourly. Okay, calculation of the maintenance dose. Okay, now first let us take a look at what the pharmacokinetic parameters we are aware of. First one is half-life, which is equal to 0.693, that is natural logarithm of 2 into the volume of distribution upon clearance. These are the parameters we are aware about. Steady state plasma concentration, also known as CPSS, steady state plasma concentration. This is basically achieved in 4 to 5 half-lives. This knowledge we have from general pharmacology. Maintenance dose is defined as steady state plasma concentration into clearance into dosing interval, which in this case is 12 hours. And one more important fact that we need to know about maintenance dose, it is decreased in patients with, yes, very good, renal or hepatic impairment. Fine. Then loading dose calculation is done by this formula, volume of distribution into steady state plasma concentration. Now let us approach the options. Drug clearance rate, number of doses needed to reach steady state, size of loading. Okay, let us see them one by one. Drug clearance rate is the correct answer, which I told you already, because elimination rate, first of all let us understand what is drug clearance, then we will talk about elimination and everything. Drug clearance is defined as a volume of plasma cleared of a drug per unit time. Per unit time. Multiplying these two parameters, we get the elimination rate, or the drug, or the amount of drug eliminated from the body per unit of time, which is steady state plasma concentration into clearance. Maintenance dose can then be calculated for the appropriate dosing interval by multiplying the elimination rate by the time between doses. So maintenance dose, I told you, all of you want to do your MD in medicine or MD in pharmacology, whichever subject you want to do your MD in. Maintenance dose to clearance and multiplying it by the dosing interval. So this is the correct option. Now let us rule out the others. Number of doses needed to reach steady state. Now when the drug is administered more quickly, this you know, right? If you give more of drug, administer the drug more quickly than the amount of drug eliminated, like you give 4 here and there is only 1 elimination, then the amount, then it starts to accumulate, right? 4 goes, it accumulates until a steady state plasma concentration is achieved. The amount of drug elimination also increases until the amount administered equals the amount of elimination. This is known as steady state plasma concentration. Drug administration equals the drug elimination. When it is administered at regular intervals, the time needed, I told you, 4 to 5 half-lives. It takes 5 half-lives to reach more than 97%. The exact size of each dose or interval between doses does not matter. What matters is that the rate of drug elimination should be equal to rate of administration. Then size of loading dose. Loading doses are larger. They are larger than maintenance doses. This you need to memorize. They can be used during treatment initiation to shorten the time to reach steady state plasma concentration, that is to saturate the tissue stores. They are useful when immediate therapeutic response is needed, like you use some life-saving antibiotics, or when using drugs with extremely high volumes of distribution. Example of such drug is, lots of drugs are chloroquine, anti-malarial, amiodarone, antiarrhythmic. Total body weight influences the volume of distribution and is often used when calculating the loading dose. This is used in calculating the loading dose. These parameters are not needed when calculating the maintenance dose, because the amount of drug lost per unit time depends only on steady state plasma concentration and drug clearance, two parameters. Fine. The educate volume of distribution, again I told you this is used in loading dose. Clear? Clearance determines the dose rate required to maintain a given steady state plasma concentration.